friends, welcome to Therapy Thursdays on Louisiana Living. We are physical therapy and balance centers. I am Angela Yarborough and this is Dr. Jerry Yarborough. And what are we doing here? Well, we are talking about different disease processes, and we are just talking about different ailments, different things that keep you from loving your life. That is one of our mottos, is love your life. And we just wanted to give back to the community and just give you some things that you can do for some things that might be preventing you from loving your life. So why don't you tell us exactly what we're going to be doing?
All right. First, like you said, I'm Dr. Jerry Yarborough, physical therapist, and my sweet wife, Angela. By trade, she's actually a nurse. So, together, I opened the Jonesboro Clinic about 20 years ago. I actually have about 27 years experience as a therapist. And then 7 years ago, we opened up here in Ruston. And just about 3 weeks ago, we opened up in Dorado, Arkansas now. So what we're doing, like she said, is we're talking about different diseases or impairments that are affecting your quality of life. And at Physical Therapy and Balance Centers, our desire is to help you love your life. So we're going to discuss those impairments. We're going to discuss how physical and occupational therapy can help you rehab from those impairments. And then we're going to always give you a takeaway of what you can start doing immediately to start making a change in your life and improving your quality of life. So again, come and see us every Thursday here on Louisiana Living. You can look us up on myarclemis.com or our personal Facebook page, physicalruston.com. Or you can even go to our Facebook page or even our YouTube channel. We have lots of videos and lots of education out there to help educate the community. Now, we want you to come back in the next two segments in which we'll start talking about certain ailments or impairments. And then, like I said, what physical and occupational therapy can help you overcome those impairments. And then again, we're always going to leave off with what you can do immediately to start helping improve your quality of life. So come back and see us and we'll get started. Thank you.
Welcome back to Therapy Thursdays. We are physical therapy and balance centers. I'm Angela Yarborough and this is Dr. Jerry Yarborough.
Welcome. I am a physical therapist and we are the owners of Physical Therapy and Balance Centers of Ruston and Jonesboro, Louisiana, and now El Dorado, Arkansas. And so what we're talking about today is low back pain. As we've talked about before, millions of Americans are affected by this each and every year. And physical therapy is a very good intervention to help you overcome low back pain. Either through our manual techniques, we teach you different flexibility, strengthening exercises. We do some manual work. We got laser and trigger point dry needling, things like that we can do to help you overcome this. But a very common thing that people like to do at home is inversion tables, getting lumbar traction. Now, lumbar traction is supported very well by research. But what concerns me as a physical therapist for this community is that the inversion tables are sold off TVs or at garage sales and people buy them not knowing what to do with them or how to do it, and lots of injuries occur. So today I wanted to go over and show you the proper use of an inversion table, okay? There's a lot of different brands. I did a lot of research, and my main concern now when you are picking an inversion table is that it's made of very good sturdy construction and no flimsy pieces. That the foot piece is going to hold you very securely once you insert your feet and close that in on your ankles. It will hold you securely without causing pain. None of this should cause you pain. If it does, you stop immediately, okay? So you're gonna position it for your height, secure your feet in, and then you're gonna lay back on the table. And I didn't tell y'all, this is Allie. She is one of our administrative assistants here. So when you lay back on the inversion table, you should get to pretty much a neutral position. And then to do the inversion, you're going to raise one hand, and you should go back some, and then your second hand. and then you should go back even more. Now, I only suggest that the max you do is about a 60-degree angle, getting about a 60% traction on your lumbar spine. You're gonna hold this position for only about 30 seconds, and then you're gonna bring one hand down, and then the next. And that's gonna bring you back to a neutral position. You're gonna stay here for about 30 seconds, and then you're gonna do it again. I suggest you do that 10 times. If you do it daily, if you have chronic low back pain from degeneration or something, daily usage is very important. And come back. It is very important that if you have any medical diagnoses, especially heart conditions, high blood pressure, any eye problems, or any other diagnosed medical conditions, that you talk to your doctor before you try to do an inversion table. It can cause you more harm than it does good. So come back in the next segment, and I'm going to talk to you about different forms of lumbar traction that you can do without an inversion table at home to help you. Welcome back to Physical Therapy Thursdays on Louisiana Living. I'm Dr. Jerry Yarborough, physical therapist at Physical Therapy and Balance Centers of Ruston and Jonesboro, Louisiana, and now El Dorado, Arkansas. Now, in our previous segment, what we were talking about was back pain. Now, back pain caused from either muscle tightness or degeneration of the lumbar spine. It could even be a disc issue, but again, any medical diagnoses you want to clear any of this with your doctor or your physical therapist before performing. So what we're talking about is doing some traction to the lumbar spine that helps open up those spaces in between the vertebrae, relieving any compression on the nerves and opening up the disc spaces. It helps improve circulation and spinal alignment. So we talked about the inversion table in the previous segment, and now I'm showing you some things that you can do at home today, right now, to help relieve some of your back pain. Now, again, remember, if anything causes you increased pain, stop, do not do it, all right? It should not increase pain, this should decrease your pain. So in a supine position with your knees bent, like so, you can push on your upper thighs here, just push with your arms, and that's gonna cause an elongation of your trunk, again, providing some traction to your lumbar spine, opening up those spaces. You wanna hold that for at least 30 seconds and do it about 10 times, okay? Another good exercise to just kind of help open up the lumbar spine is what we call double knee to chest. You're gonna put your hands back behind here, you're gonna pull your knees up toward your chest, hold it for at least 30 seconds, and you can do that, again, 3 to 10 times. All right. Another thing that you can do at home is in a seated position to get some lumbar traction. You're just going to sit in an armed seat. You're going to relax your trunk, relax your spine, and you're just going to push up with your arms the best you can. As you can see, that elongates her trunk, providing some lumbar traction. This can really provide some good relief. And one more thing that you can do at home, you can find something to hang from. So you're going to hang from, just take the weight off of your legs, and that's going to provide a good traction to your lumbar spine. You can try to hold it for 30 seconds or whatever your arms will let you do. And try to do that again 3 to 10 times. So these are all good exercises that you can do at home to provide some traction to your lumbar spine to help decrease some of that pain and muscle tension and help you love your life like we do every week. I want you to come back next week and we'll be talking about another impairment that affects your life and how physical and occupational therapy can help and things that you can do at home immediately to help you love your lives. Come back and see us next week. Thank you.